Hey, it's Jessica DeMassa with WTF Health. What's the future of health? I'm talking to the who's who of health tech and healthcare innovation, and today I'm doing it from Artera's first ever customer event called Heartbeat, and I'm checking in on what's going on with patient experience and the changing thinking around technology and the patient journey. So here to help us get smart on this, we've got Omkar Kulkarni. He is the Chief Digital Officer at LA Children's Hospital. Omkar, good to have you here.
Nice to be here. Thank you.
I love checking in with you. It's been a while, and an update on peds-focused here in a little while, KidsX. So we'll find out what's going on with that soon. But I want to ask you right off the bat, one of the challenges it seems like when it comes to patient journey is just simply integrating technology into the process at all. Do you think that that's starting to change where we're at today?
It is. I think we've been on this journey for about 7 or 8 years now, and I think we're finally figuring out the technologies have picked up to a point where they're automating a lot of the things that used to be done manually. We're finding ways to think about what the workflow is right at the beginning of any kind of project or any kind of initiative we launch. And the data we're capturing around workflow and efficiency and how we can actually ensure that these things are not adding time and actually, in most cases, reducing time that our staff are spending on different operational workflows. It's changed so much over the last, I'd say, 3 or 4 years, where today we can show that a lot of digital technologies are making things faster, easier, take less time for our doctors, our nurses, our staff, all these different people. So it has changed quite a bit, but there's still a challenge. It's getting a lot better.
All right, what's the challenge then right now? Like, what's the big deal? If it's getting better in terms of demonstrating the value of it, is it uptake? Is it integration? Is it like, blending things together to create a seamless experience? What's the big challenge right now for you?
Well, I think there's a couple of challenges. So one is, and they talked about it here at the Artera conference, one is there's still a lot of vendors that we're engaging with as health systems to deliver experiences for end users, whether it's patients and families or with providers, and putting all those different vendor technology solutions together is really important so that it's less clicks, less messages, and whatever else. At the Artera conference, we talked about some solutions they've got coming out soon that are going to be able to bring a lot of that together. And it's a great example of how I think we're going to be able to see more harmonization, in a sense, of these different vendor solutions that are out there.
Yeah, I think the stat I saw was it was like on average there's 11 different phone numbers texting a patient at any given one time from a health system. That's crazy. Yeah. So, talk to me about like your experience at LA Children's. And one of the things I want to really just kind of dig into is the fact that it's like, your patient is a child. So you have to consider the caregiver that is with them, right? They're making the decisions, they need the communication, and it's like there's the communication between mom and dad and the child. And, there's a lot to consider there. I'm wondering what you feel like, more general health care organizations can learn from how you guys are designing patient experience to be inclusive of the caregiver when maybe they don't often think of the caregiver, when they're designing their own patient experience, just being so singularly focused on the patient themselves.
So I'll even add it one more, right? So there's actually often 2 caregivers. There's sometimes mom and dad, or 2 parents, or 2 caregivers, whatever else. So you think about text messaging technology, right? You send a text message reminder to a patient in an adult health system. That's one message to one end user, a patient, as you pointed out. But in peds, you're sending it to the patient. If let's say they're 14 years old, you may send it to one parent. The other parent needs to be engaged too. Sometimes those parents, live together and co-parent. There's so many different situations, right? We've got to, as a health system, we can't have a customized thing for every individual kind of use case. We have to think broadly about how we can engage patients and families, whether they, with lots of different end users. So some of the things to think about are, what are the demographics and what are the considerations for the patients, right? In our case, they're under 18. They're part of a specific digitally engaged generation. And then you've got caregivers who could be of various generations, various access to digital, various comfort zone with digital, and that's different. And then they're also not experiencing the healthcare themselves, right? They're experiencing on behalf of somebody else. So now think about remote patient monitoring, think about patient-reported outcomes, things where in the patient, when there's just a health system communicating with the patient, the patient knows what's going on. They know their symptoms, for example. If I try to ask, a parent to rate their child's pain, for example, right? How do you do that?
Yeah.
Like, I've got an 8-year-old. How do I ask my 8-year-old what's her pain, and how do I know that that's going to resonate with whatever the doctor needs to know? It's hard. It's challenging. We've got to figure out how to do that.
I love though that you're mindful of trying to speak in a language that the patient understands. And one of the great, points you made, you were on a panel talking about digital empathy. And I love too, even just thinking about, being mindful of the people who are using the technology that you're choosing to implement. So talk a little bit about that. Like, how do you make choices about which technologies to put in place and which ones to pass by and where to put them in the process?
Yeah, we use something called the love metric. I was mentioning it there. I think it's all about figuring out, and it's something that I've borrowed from other great leaders in the space. So the idea is about customer benefit, right? What are the things that our patients and families are ultimately going to love when we bring to them? What are the features? What are the tools that are going to add value to their lives, to the way they engage with us? And at the end of the day, it's all about making choices about what are they going to love the most. What needs are we going to ultimately deliver on most? Where they're going to tell their friends about it. They're going to say, "Hey, listen, at Children's LA, they've got this great feature. Go check it out." And those are the kinds of things we strive for, because I think that's what's going to create adoption. It's going to create value for us, for them, and that's how we really prioritize different options that we have.
When it comes to the folks making the ultimate decision about technology, I thought you also had a great point about how you have to kind of put yourself in the patient's place as far as what's accessible. So say a little bit about that, because you made a great point about socioeconomic class, data plans and those kinds of things that maybe, when you're working in a hospital system, you have a different health plan, different data plan than the patients that you're serving.
Totally, yeah. So when we're thinking about the different solutions we want to bring, we often are in a room with people who are thinking about, well, it would be great. I would love to use this. This would be great for my kids. This would be great for my experience. But we have to remind each other, including myself, that to your point, we don't often represent the patients that are walking through our doors, right? We've got a very diverse patient population, many of whom have different insurance, different access to digital technology, different access to data, so many things that are different from us, right? So if we build solutions based on what we think as leaders in healthcare are great, we're only going to be building solutions for ourselves, which isn't really representative of the population that we're trying to build for. So what we do is we deeply engage with patients and families. We work with our patient family advisory councils, which are these, I'd say, focus groups of patients and families that actually want to provide feedback on products. We do surveys. We look at patient experience data. We create a holistic kind of data set to figure out what our patients and families ultimately will love, in terms of the products we bring.
All right, I have to ask about this because I feel like this is a big overarching theme in patient experience lately. The expanding of the care delivery market into like retail health or virtual care clinics. And I know peds is not immune from, the pressure of that. I mean, there are things, somebody was telling me the other day about, a pediatric service they could sign up for and just get virtual care, on demand 24/7. So how are you looking at patient experience and maybe these increased consumer demands for top quality, frictionless experiences in terms of how that's now guiding the way you're putting together a digital strategy at LA Children's?
It's a key driver of our strategy, right? So it pushes us to push the kind of boundaries of what we want to do. The reason is this: our patients and families are exposed to those same digital experiences when they shop for medication or when they get their medications, when they shop for retail, purchases, whatever else. And so those are the same people that are coming to us, and they have some expectation that interacting with us is going to be just as easy as it is to, buy something on Amazon or buy something at CVS or whatever the case may be. So we're using those experiences as inspiration for us to think about how we can creatively do things. An example is in the pandemic, we stood up, and so did many others, digital vaccine clinics, right? Not digital, excuse me, drive-through vaccine clinics, right? That idea came from so many other places that were offering drive-up solutions, right? So it's just one of those things where you see what's out there, you see what customers in other parts of the industry are like relating to, what they're driving to, what they love, and we then kind of try to emulate some of those things as we think about it. We're thinking about food delivery, for example. How do we think about, for our patients who specifically may have food scarcity, food insecurity, and they identify that through various social determinants of health screeners that we have, how can we think about delivering food to them or having food available to them at our hospital? We're thinking about all these different things, and it goes back to looking at other industries to see how they're doing it and is getting inspiration from that.
All right, that's awesome. Okay, last thing for you. KidsX, Okay, so for those who don't know, Omkar founded and invented this accelerator that's specifically focused on bringing more technology and more innovation into the pediatric world. So what's hot right now coming through KidsX? I mean, you've got your finger on the pulse, the frontline, emerging startups that are bringing new technology in. What's hot right now? What are they focused on, solving with technology?
As I'm guessing your audience knows, but pediatric mental health is a incredibly important, underserved, and growing problem in this country. I think there are more and more kids, especially through the pandemic, who need pediatric mental health care services. And what's great is digital is playing a great role there. So there are so many startups that we're seeing, really promising ones that are using everything from virtual care to now even generative AI to think about how to engage with kids and mostly adolescents, teenagers, as it relates to mental health. And I think there's a tremendous amount of opportunity as we think about how those startup companies engage with pediatric health systems and health plans to bring these solutions to the national market.
That's awesome. Well, Omkar, thank you so much for letting me pick your brain. It's been a pleasure. All right, everybody, that's Omkar Kulkarni. He is the Chief Digital Officer at LA Children's Hospital, founder of KidsX too. Can't forget that. Thank you so much for letting me pick your brain about the patient experience here at our Terrace Heartbeat event. For those of you who are looking for the rest of these thought leader interviews, check them out over at my YouTube channel. It's www.youtube.com/WTF Health. We'll talk to you guys real soon. Thanks so much. Bye.